For those who don't know you or are meeting you for the first time, could you tell us a little bit more about yourself and your journey in dentistry?
Yeah, well, I'm a registered dental hygienist by profession, and I started out in dentistry back in the late 70s, joining the military as a dental nurse. So my career started in dental nurses in the Royal Air Force, and I went on to become a hygienist and trained within the Air Force and qualified in 82 and served at home and abroad in a clinical role, treating obviously servicemen and their families overseas, and also when I served in Hong Kong, out in Nepal and Borneo, doing various or health promotion roles as well as a clinical role. So my last 10 years of service, I commissioned to become the officer in charge of the hygiene training school, which was down at Aldershot. So the journey really went through from clinic dental nursing into clinic and into academia, into the training and education world. So I served for 25 years in the military, and then left and went into a commercial role for TP, oral hygiene products, where I was the clinical and education projects manager, where I worked primarily within all the dental schools of hygiene and dentistry, looking at behavioural change and getting patients to change behaviours to start to include into dental cleaning. So that's essentially been my role over the past 46 years. I'm retired now from a paid role,
Yeah.
but I work in various areas in dentistry still.
Okay. And how did your military experience and background shape your approach to prevention and public health?
I think so in the military, it's a fairly small cohort of individuals.
Yeah.
If you think about the population, they're young, healthy, fit individuals primarily that you're treating for all the servicemen and women. But what we started is what I was seeing quite clearly. I was quite interested in behaviours and quite interested to see note that actually our smoking rates in the military were significantly higher than that of our civilian counterparts at an age where you wouldn't expect to see it. And I guess it started there when I was looking at what is it we do differently? How do we are we promoting this? And what's causing this? And so I took a master's in generic health promotion. And that was really my subject area, looking at smoking, looking at why our young, fit individuals were taking on this habit, and then understanding just how difficult it was to give up and what we could do about it. So essentially, I suppose that's what, because you noticed a change when we compare ourselves with our civilian counterparts. There's a difference. Why was that different?
And did you find out why that habit was different in the military?
At the time, so we were talking about early 90s now. By this time, at the time, we still had a very obviously what we were doing. People were joining up, particularly armies. I was working down in Aldershot at the time. They were coming into the military having been non-smokers, and then within a very short space of time
Oh,
became smokers. So it had to be something we were doing, and it was down to our culture. At the time, you didn't have no smoking in the mess, so you would go to a dining in night and be sat next to a smoker, whether you liked it or not, which was I
yeah.
found pretty difficult. But we also, when the recruits were in training, there would be something called a naffy break. That's when you're going to have a cup of coffee and your cigarette or whatever. And it was sort of ingrained in the culture of some of the cadres where you only got a break if you had a cigarette. So it made sense to have a cigarette and go out and join your mates. Otherwise, you were continuing to do that. I mean, traditionally, obviously, the military gave cigarettes to the navy, etc., in the past, but this was a window of a newer time. So it was about culture and it was about behaviours. So yeah.
And so your session title suggests caution around alternatives to smoking. Do you think we're simply replacing one problem with another when it comes to vaping and oral nicotine products?
I think vapes came in because they were first produced by a Chinese pharmacist who was desperate to find another solution, actually, to giving people the nicotine they needed to come off combustible tobacco. His father died of a 40-a-day habit. So vapes, in theory, when the vape came in, a heated nicotine, not combustible, therefore less damaging than smoking, not without harm, but less damaging than combustible tobacco, makes sense for patients wishing to give up tobacco. And it's highly regulated now. It wasn't at the time, so it came in 2007 into the United Kingdom, but by now it's regulated under MHRA. There's a yellow card system for adverse reactions. So those vapes that are purchased legitimately in this country are as safe as they can be, safer than they were, and highly regulated. Quite as regulated as tobacco, because of course the United Kingdom has the highest regulation across Europe. But vapes are the next option on for people wishing to give up smoking. Oral nicotine pouches, however, have come into the country now, and they're not snus. Snus is tobacco in a little tea bag that's put in. That is illegal to sell in the UK. But the pouches are basically powdered nicotine in a little tea bag that's placed in the buccal mucosa. They do not come under any kind of regulation. So these are a general food. Their labeling is not mandatory. They don't have to state what milligram of nicotine is in them. And when you consider these again are a step away from vaping. So you're not inhaling something, but it's being absorbed in the mucosa. The cynic in me would say, the tobacco companies are desperate. They need to keep us addicted to nicotine. So they've now own most of the vaping products brands out there. They have about 165 vaping brands in the UK. They now own the oral nicotine pouches. So it's almost, if you think about how their attitude to vapes is it is the medicine for what we caused here. So you can take this, and now we're saying, well, actually, these are the medicine for that. But it's all nicotine. And because it's unregulated, the milligrams in the nicotine pouches are a concern. There's a lovely piece of research looking at scoping it. I think Lathadavda in Dental Health, which is the BSDHT's clinical journal. They looked at 260 odd brands, and their milligram per ranged anything from 0 to 120 milligrams. 20 milligrams is the legal advised rate of nicotine. Of nicotine in a product. So we have a problem.
Yeah. Okay. And in terms of clinical practice, what oral health impacts are you seeing from long-term vaping and oral nicotine compared to traditional tobacco use?
The vaping is a difficult one for us to answer because it's a relatively new habit, and the majority of vapers are also or were smokers. So the long-term effects of both the mix and quite a lot of our smokers are dual smokers and vapors. So they're cutting down and using a bit of both. So that's actually quite hard. But what we do know are the oral effects of nicotine on the oral mucosa, and they're no different. We're still seeing this damaged DNA and oxidative stress to the tissues. We still see a poor wound healing, all because for the same reasons we see it in combustible tobacco. The metabolite of nicotine affects the tissues, the soft tissues. So that's hard to answer. We do see specific patterns of staining in vapors, particularly if they use the more woody brands. So the vanillas flavoring, we're starting to see, so it's a very sticky and darkened, very different to that of tobacco. For patients using the nicotine pouches, we do see oral manifestation. We are starting to see those. So again, going back to Lathadavda's scoping review, we're seeing the tissue is getting a little leukoplakic patches mimicking leukoplakia. So where the pouch is placed, because it's called pillowing or lumping, it usually goes in the anterior buccal mucosa. So in the area where it's placed, you get a local area of a redness, blistering in some cases. We're seeing blockage of the minor salivary glands. So looking not unlike the old, let's call it stomatitis nicotinia, but the blockaging of the tissue, the little salivary glands, we see these little red dots. Some patients will experience burning and a strange sensation in the jaw they will complain of, and dry mouth. So it does have oral manifestations. Yeah, yeah.
And so the UK government has taken steps to restrict disposable vapes amid concerns about youth uptake. Do you believe regulations keeping pace with the behavior change?
No, no.
No.
Unfortunately, technology went far, it goes too fast for everyone, certainly for UK legislative law. So, whilst we regulated over time the use of vapes, these are much harder to regulate for because, one, they're very discreet. You don't know they're using them necessarily, but they do need to be regulated as a tobacco product. In some states in America, they've already created a new category. So whilst it's not a tobacco product, it's products made from tobacco. So it's almost a half step. Either way, this needs regulating. You can go online and get yourself, tick the box and say you're 18 and get yourself a sample, which cannot be right. And it contains nicotine at really high levels. So actually the propensity for addiction is much, much higher. We are starting to see evidence that young people are using this all-time like vapes. They're not meant for no smokers, but we have got cohort of youngsters that use them and have never smoked. And it's true of these oral nicotine pouches. They're really hard to detect. They get an immediate hit. There is there's a nice description of youngsters gaming each other. So they goad each other to place more pouches than they need, and then they lay down ready to get the hits, and they obviously get nauseous and they get an incredible high. It's a dangerous game because what we know about nicotine and developing organs is it's not great for developing brains. So that it's not just really about the oral effects, it's about the potentially systemic effects for lifelong effects for these kids that are using them. So yeah, we need the government, we need someone to step in and soon.
Okay. And what practical language or techniques should dental nurses and hygienists adopt when discussing vaping with defensive or skeptical patients, or even younger patients who maybe come in with their parents in practice?
I think, we ask about smoking as part of medical history, and that medical history we should say, do you use tobacco or tobacco products? And then be quite specific, because so that's the first, get it on the records. And then inquire, ask about their habits. Some patients are contented smokers, vapors, and don't wish to give up, and that's fine. But we need to log that on the documents and monitor. And individuals, if you spot a lesion in anyone that uses any one of these products, you treat them as you would any suspicious lesion, and with a heightened risk because of this particular habit that they have. So, we're not the police in dentistry. We're here merely to support patients. And would we support patients giving up smoking using vapes? Yes, absolutely. Would I support, somebody giving up smoking using or nicotine pouches? I would support them, yes, but be mindful that they're not without harm. And we'd like them actually to come off of nicotine altogether. However, the reality for us, it's a free world. And so, patients, we're not here to regulate patients. We're here to signpost them to help if they should need it.
So, as you said, you would consider smoking, vaping, or nicotine a conversation that is mandatory in oral health assessment then?
Well, under the guidelines, we're asked, we have to use the 3 A's: ask, act, ask, advise, act. So all of us need to do that as part of our normal medical history. And that can include the use of other tobacco products. And as individuals, we may not know a lot about them. But we'll start to see more clinical data supporting that. And you may well, the patient, if it's a younger individual, may not have said that they use tobacco, but you see a lesion. They're quite obvious and discreet. And then you just, as any clinician would do, would be to inquire.
Okay.
So you treat it with suspicion. But I think it won't be very long actually before we change mandatorily the way we ask in practice. It's difficult. You're here to do a treatment to look after the patient. Some patients really don't like answering questions about their habits, about their alcohol consumption, about their diets, etc., etc. But it is our role to be to one, know what's out there, and to be able to signpost and advise patients.
Okay, and for delegates attending your session, what is the one mindset shift you want them to leave with?
I'd like them to feel a little bit more confident in supporting patients wishing to give up smoking. And vaping does have a role and it is extremely effective. It isn't without harm, but it is less harmful to both the individual and others than smoking is like it is, we believe. Oral nicotine pouches are new. But of course, snus has been used over Scandinavia since the 18th century. We know its links when it's with tobacco. We don't know enough about its direct powdered form nicotine on the mucosa. But I think we can take an intelligent guess. Anything that constitutes a chronic irritant that's used regularly will certainly impact on the oral tissues. Whether that leads into cancerous changes, DNA and cellular changes, we don't know, but we certainly see it's being used. So I think the takeaway is gen up and, just be able to support and signpost patients.
And anything else you'd like to share?
Only that the government are doing their best. I know there's a bill. There's obviously lots of moves by the ASH, Action Smoking on Health, and the medical fraternity. We are pushing towards it. It will take time. I'm not a big lover of getting a thing through on my phone about change.com, but actually when these come through for the legislative change for health, then we can be pretty impactful in our cadres in supporting these acts as they go through. I think, unfortunately, it's like all things, we only made a big fuss, if you like, about vapes when we started seeing people being damaged and hurt by them.
Yeah.
And we're seeing damage and people being hurt by nicotine pouches. So it will come. So I'd say join the battle team and get your names to any acts and bills that come through that want change, and we need to change this.
Thank you.